Hi, this is Dr. Jin Sung, and welcome back to Thyroid Success Secrets number 9, Anemias. I've mentioned in the past before that the number one cause for hypothyroidism here in the United States is an autoimmune thyroid called Hashimoto's thyroiditis. But the question I get is, what if the patient does not have an autoimmune condition? Since there's a small percentage of patients that are not autoimmune, what else can be causing their problems or all their symptoms? Anemia can be the answer. Anemia in of itself can be a deal breaker for nutritional support of any kind, including thyroid support, since anemia literally starves your body of oxygen. Oxygen is a very important component in healing your body. If your brain and nervous system does not get the two things to survive, which is fuel and activation. Fuel comes in the form of oxygen and glucose. We'll talk about glucose in the future, but if you deprive your body of oxygen, your red blood cells cannot carry that oxygen to where it needs to get to. The basic function of the red blood cells is to maintain, regenerate, and heal the body. With no red blood cells, the body simply cannot function. It is vital that the clinician addresses the anemic patient. Anemia can be due to a variety of different reasons or factors, including B12 anemia, pernicious anemia, or an autoimmune disease. Some forms of anemia don't seem to respond to iron supplements because the red blood cells break down. So when this happens, supplementing won't increase iron levels, and it can, in fact, make the problem worse. Too much iron in the body is more toxic than mercury, lead, and other heavy metals. As I've said and will continue to say, if the patient does not have an autoimmune condition, you want to look at the 4 priorities. The 4 priorities are this. Number 1, anemia. Number 2, blood sugar. Number 3, gut and liver function. And number 4, fatty acid metabolism. All of these systems need to be checked in order to address these patients who continue to suffer from these symptoms, but yet do not have an autoimmune thyroid condition. My name is Dr. Jin Sung, where clinical excellence meets excellent results.